In today's video, we're going to talk about Medicare Advantage Plans exiting, okay? They're going to discontinue their plan for the following year. And we're particularly talking about the state of Georgia, okay? So we're going to tell you what you need to do if your plan has decided to exit. You're going to get a letter from the insurance carrier. They're going to let you know that they're no longer going to renew your plan for the following year. And you may be surprised of some of the things that you can do. So definitely stay to the end of this video, and we're going to tell you exactly what you need to do to make a smooth transition into your next plan, okay? So welcome to the channel. My name is Patricia. If you have any questions, comments, concerns, leave them in the comment section below. But let's get started, okay? So like I said, so many plans are going to exit out of Georgia. There are two main insurance carriers that is really popular. I'm not going to say any insurance carriers' names, but they're moving out of some areas in Georgia, okay? So listen, you definitely have options, and we're going to tell you exactly what you need to do. So number one, you have a special enrollment period to go ahead and change your plan, okay? This is going to start from December 8th to the end of February, okay? You can utilize this special enrollment period to go ahead and change your plan. You can also change your plan during the open enrollment period as well, which is October 15th to December 7th, okay? So the first thing you're going to want to do is think about changing your plan to a new Medicare Advantage plan, right? So you're going to go from Medicare Advantage to another Medicare Advantage plan. Now, what you want to do, you want to do your research. You want to talk to a broker that you trust, that understands the plans in your area, and our office can definitely help with this, okay? So like I said, you definitely want to reach out to a broker that understands the plans in the area, and there is a checklist that I want you to go by, because I don't want you to switch your plan just to find out that my doctors are not in network, medications are not covered, okay? So this is going to be your checklist, okay? You're going to have all of the medications that you're taking. You're going to make sure that you have all your medications. All of your doctors, do not forget your specialist, your eye doctor, your dentist, all of that. You want to make sure that these providers are in network, or at least most of your providers are in network. You also want to remember anything special going on. Sometimes people forget this particular step. Anything special going on with you? Do you have home health coming into your house? Is that provider in network? Do you have oxygen? Are you on oxygen? Are you getting any type of special treatment, dialysis, diabetes? You know, all of these things you want to make sure you check all the boxes to make sure that when you do change over your plan, everything is nice and smooth, okay? So it's very important to make sure that all of that is in order before you switch over to your new plan. Another option that you have that you may not know about is that, did you know you have a guaranteed issue to go ahead and switch to original Medicare with a Medicare supplement plan? Yes, if your plan discontinued in your area, then you have a special reason to get on a Medicare supplement plan. So if you have been wanting to get on a Medicare supplement, but you're unable to get on it due to underwriting issues, meaning that you have a health condition that prevents you from passing the underwriting questions to get enrolled in a Medicare supplement plan, you can actually utilize this time to go ahead and enroll in a Medicare supplement. Now, the Medicare supplement is going to work different from your Medicare Advantage. Your Medicare supplement plan will pay the 20% that Medicare leaves behind. Now, you will have a monthly premium with your Medicare supplement, but like I said, it pays the 20%, and you could go to any doctor that takes original Medicare. You don't have to worry about pre-authorization. You don't have to worry about networks, PPO, or HMO plan. Long as your doctor takes original Medicare, they would take that Medicare supplement plan, okay? So that is your next option, and that is go ahead and enroll in a Medicare supplement plan. Now, if you go this route, you also need a standalone drug plan, so don't forget your medications. You also need to have your broker research the medications that you're taking and all of that, so that way you get on a Part D standalone plan that works for your particular needs and your medications. So why are Medicare Advantage plans coming out of certain states, coming out of certain areas? It's due to the Inflation Reduction Act. So a law was passed to reduce the cost of medications. So medications was capped. The max out of pocket that an individual can spend on high cost medications is $8,000. However, due to the Inflation Act, now the max would be at $2,000. So this means that Medicare beneficiaries, insurance companies will have to eat up some of that cost, right? So most of it is going to be eaten by Medicare Advantage companies. These insurance companies are going to have to eat up $6,000 of medication costs, right? To you, it's $2,000. That's your max. But the insurance companies will have to eat up a lot of that $6,000 difference, okay? From $8,000 to $2,000, that is a big difference. So the insurance companies had to come up with a plan to survive, okay? So they're going to make changes to benefits and copays and such. And some of these changes are, we are going to just completely come out of certain areas, okay? So that is why this is happening. These insurance companies had to adjust and look at the market in the areas that they're servicing and decide we have to make some cuts. And this is one of the cuts, and that is coming out of certain areas. So that is why this is happening in Georgia and other states. Alrighty, so I hope I made it crispy clear on the things that you can do if you lost your coverage, if you stay in Georgia. So no worries whatsoever. You can make a pretty simple transition as long as you seek out a broker, like I said, or if you want to do this research yourself, that's fine. But just make sure you check all of the boxes: medications, doctors, special treatments, hospital networks. All of that you want to make sure is in network with your new Medicare Advantage plan, or like I said, you could go ahead and enroll in a new Medicare supplement, okay? So if you have any questions, leave them in the comment section below, and we'll be more than happy to answer your questions. Georgia, you got this. Alrighty, thank you so much for watching, and I'll see you on the next video. Bye.